Hi, today I'll be sharing about acute appendicitis. So, first of all, foremost, we need to take a history of this patient who has come with uh, of whatever that we are going to elicit in history in this condition, basically. So, I'll be explaining the history and whatever complications of it and differential diagnosis and all that. So, first and foremost, um, when I take the history of a patient, I would come to know that the pain, the onset of the pain will be within 24 hours. The onset of the pain will be within 24 hours. And there will be a progressive, persistent, mild abdominal discomfort. At the same time, there will be even pain around the umbilicus or para-umbilical pain, and the pain will shift from the umbilicus to the right iliac fossa. So, at the same time, there will be, of course, fever, vomiting, anorexia. Anorexia, the patient will go, very thin, anorexia, and at the same time, there will be I think that's about it. I've said all that. So now coming to physical examination. Physical examination is on inspection. There will obviously be guarding and rigidity because patient is experiencing pain. And first and foremost, upon palpation, when I palpate the site of the pain, which is at the right iliac fossa. So when I palpate that, and when I remove my finger, the patient will tell that it is very painful, and that is rebound tenderness. The sign that I'm eliciting is Blumberg sign. And also, on the other hand, there will be there's another sign called Rousing sign. Rousing sign is where I put my hand at the left iliac fossa, and when I press and then when I remove, there will be pain on the opposite side, which is the right iliac fossa. So when I put my hand on the left iliac fossa, the right iliac fossa gets pain. So that's another sign of acute appendicitis. So these are so that is inspection and palpation. The findings upon inspection and palpation. So now coming to the complications. What are the complications of acute appendicitis? So the complications of acute appendicitis would be appendicular abscess, appendicular mass. There will be gangrene as well. Also, there will be mucocele. So, and appendicular mass, appendicular abscess, gangrene, mucocele. Basically, these are the four complications of acute appendicitis. There's actually one more, but I'll check it out later on. What is it? And coming to investigations, so now I've already known all these things, so I would move on to investigating. So probably what I will investigate, I will take this full blood count, and also especially to check the patient's white blood count, white blood cell level. So white blood cell level will be more than 10,000 microgram, and also there will be urine analysis. I will be taking a sample of the patient's urine for urine analysis, and what I would discover, it will be pyuria, hematuria, blood in the urine, and albuminuria, presence of protein in the urine. So why albuminuria is because of a biomarker called protein LRG. Apparently, I did a bit of research on that, and there's a presence of protein is because of a biomarker protein allergy found in the urine. So most probably it's because the appendicitis, the appendix has already been inflamed, so you will irritate the kidney as well and the ureter. So that's how it causes the protein to be also like a bit of protein to be in the urine. That's my observation. That's what that's my opinion. I feel, and also pyuria also did for the same reason, because the appendicitis will infect the ureter only in the right kidney, since appendix is on the right. And hematuria also, irritation of the ureter by the appendix also, since the appendix has been inflamed. So all of that, and also I can do a transabdominal ultrasound, and when I check, you can see that the appendix is enlarged, the diameter has been enlarged. And also I should do a chest x-ray. Chest x-ray is to take the patient's chest x-ray in the erect position, and what I will see is that there will be air under the diaphragm. Just check for air under the diaphragm due to perforation. Also I would take an abdominal x-ray as well, to further investigate about this appendicitis. So then, coming to my differential diagnosis, I would say that because since appendix is at the right lower quadrant, so many differential diagnoses I can come up with. First is pelvic inflammatory disease, and then of course in women there will be ectopic pregnancy, also ovarian cysts in women, and at the same time there will be Meckel's diverticulum, pelvic inflammatory disease, I think I've said that already, and strangulated hernia. So these are my differential diagnoses for acute appendicitis. So coming to the treatment, so how would I treat this patient who is having this acute appendicitis? So the treatment would be appendicectomy. That is the definitive method, appendicectomy. And first of all, I should do a pre-op procedure where I should get the patient's consent, start the patient on nil by mouth or nil by oral, and also at the same time will be giving patient isotonic fluid to hydrate the patient through IV, and I would also give I also would administer diclofenac or tramadol. These are analgesics to avoid the patient from getting any kind of discomfort or anxiety. And also I would give antibiotics, which are second and third generation cephalosporin, and that I would give for 3 to 5 days. And also so this is basically the general method. And to treat specific things like how to manage an appendicular mass, I would start a regimen called Oshner-Sharon regimen, and that is and also with the protocol ABCDE. It's quite a lot, that one, but the main thing is Oshner-Sharon regimen. And also how to manage an appendicular abscess. Appendicular abscess, basically I should do a CT guided percutaneous drainage. And what are the complications that would be for acute appendicitis post surgery? Complications of post surgical acute appendicitis, which are pelvic abscess, and then pelvic abscess, and one more is just give me a minute, let me think. Pelvic abscess, parallel ileus, and also post-operative wound infection, pelvic abscess, parallel ileus, and fecal fistula. Yeah, basically these are meetings. Only now I'm referring. All this one I'm not referring. Okay, so for all things, post-operative wound infection, pelvic abscess, fecal fistula. These are the three main things. So yeah, that's about acute appendicitis. So I hope you like the video, and do give me any comments regarding what I've said, any feedback, and do let me know in the comments below, and I'll come back for another video.